Once we've exhausted our treatment options for knee arthritis, including the things like injections, therapy, anti-inflammatories, we really do get into the discussion about surgery. And the reality is we can't undo arthritis. So really the options are resurfacing procedures, where we replace the cartilage with high durability materials that allow you to perform your daily activities and maintain a quality of life that you want to have. And those resurfacing procedures come in different flavors. So there's what's called a partial knee replacement and a full knee replacement. If we think kind of fundamentally about the knee, there's really kind of three main areas that you develop arthritis throughout the knee. If you just have arthritis in one of those areas, then the partial knee replacement is a good option for you. Some of the benefits of the partial knee replacement are it's a smaller surgery, so generally there's less pain afterwards. Because it's a smaller surgery and we don't have to disrupt some of the important ligaments and tendons in the knee, people say it feels like a more normal knee. We find that people are back to performing their daily activities a little faster, as well as they're able to return to some higher demand activities. In some cases, you've developed arthritis in more than one area in the knee. And in those cases, the full knee replacement is the best option for you. Really, the full knee replacement is a complete resurfacing of the knee. So there's nowhere for arthritis to develop later down the road. Full knee replacements are very durable surgeries. They're excellent surgeries. They have very good survivorship. And patients are very happy with them. So, either a partial knee replacement or a full knee replacement can be excellent options, but my job is obviously to tease out who would benefit from a partial and who I think would benefit from the full knee replacement.